Welcome to Module 2 of our course on oral health, where we'll be exploring the critical connection between breathing and oral health. In this lesson, we'll dive into the differences between nasal breathing and mouth breathing, and we'll discuss how each can significantly impact your oral health and overall well-being. Breathing is something we often take for granted, but the way we breathe has profound implications for our health. By the end of this lesson, you'll have a clear understanding of why nasal breathing is preferred and the potential consequences of habitual mouth breathing. Let's start by defining the two types of breathing. Nasal breathing. Nasal breathing refers to inhaling and exhaling through the nose. The nose is specifically designed for this purpose, and it offers numerous benefits that mouth breathing does not. When we breathe through our nose, the air is filtered, humidified, and warmed before it reaches the lungs. This process is vital for protecting the respiratory system from harmful particles and pathogens. The nasal passages are lined with tiny hair-like structures called cilia, which help trap dust, bacteria, and other pollutants, preventing them from entering the lungs. Mouth breathing. Mouth breathing, on the other hand, involves inhaling and exhaling through the mouth. While it's natural to breathe through the mouth during intense physical activity or when dealing with nasal congestion, habitual mouth breathing can lead to various health issues. Unlike the nose, the mouth does not filter, humidify, or warm the air as effectively. As a result, mouth breathing can expose the respiratory system to unfiltered air, which may contain allergens, pollutants, and other irritants. So what are the key differences between these two types of breathing? Air filtration. As mentioned earlier, nasal breathing filters out harmful particles, while mouth breathing allows them to enter the body more freely. This filtration system is crucial for maintaining respiratory health and preventing infections. Air humidification. The nose adds moisture to the air, which is important for maintaining the delicate tissues of the respiratory tract. Mouth breathing bypasses this humidification process, leading to dry mouth and other issues that we'll discuss later. Oxygen uptake. Nasal breathing promotes a more efficient uptake of oxygen. The sinuses produce nitric oxide, a molecule that enhances oxygen absorption in the lungs. When you breathe through your nose, you increase the amount of oxygen that your body can use. Mouth breathing, in contrast, does not provide this benefit, potentially leading to lower oxygen levels. Breathing patterns. Nasal breathing encourages a slower, more controlled breathing pattern, which can help reduce stress and promote relaxation. Mouth breathing often leads to shallow, rapid breaths, which can increase stress levels and negatively impact overall health. Posture and facial development. Habitual nasal breathing supports proper tongue posture, with the tongue resting against the roof of the mouth. This posture is essential for normal facial development, especially in children. Mouth breathing, however, can lead to improper tongue posture, affecting jaw alignment, facial structure, and even contributing to conditions like sleep apnea. Significance of nasal breathing. Now that we've covered the differences, let's discuss the significance of nasal breathing for your health. Optimal respiratory function. Nasal breathing ensures that the air entering your lungs is clean, warm, and moist, which is essential for optimal respiratory function. This can reduce the risk of respiratory infections, asthma, and other conditions that can be exacerbated by breathing in cold, dry, or polluted air. Enhanced oxygenation. The production of nitric oxide in the nasal passages during nasal breathing is crucial for vasodilation, or the widening of blood vessels. This process allows for better oxygen uptake and delivery to the body's tissues, improving overall energy levels and endurance. Stress reduction. Breathing through the nose activates the parasympathetic nervous system, which is responsible for the rest and digest response. This helps to lower heart rate, reduce blood pressure, and promote relaxation. Mouth breathing, on the other hand, can trigger the sympathetic nervous system, leading to a fight or flight response, which can increase stress and anxiety. support for proper facial growth. In children, nasal breathing is essential for normal facial development. It encourages proper jaw alignment and helps prevent malocclusions such as overbites or underbites. When children habitually breathe through their mouths, it can lead to a longer face, narrower jaw, and a higher likelihood of orthodontic issues. While mouth breathing might seem harmless, it can have significant negative effects on oral health. Let's explore these in detail. Dry mouth xerostomia. Mouth breathing often leads to dry mouth, a condition where there is insufficient saliva production. Saliva plays a crucial role in maintaining oral health by neutralizing acids, washing away food particles, and protecting against tooth decay. When the mouth is dry, the risk of cavities and gum disease increases dramatically. Increased risk of tooth decay. Without adequate saliva, the mouth becomes more acidic, creating an environment where bacteria can thrive. This leads to a higher risk of dental caries, cavities, and tooth erosion. The lack of saliva also means that food particles and bacteria are not effectively washed away, further contributing to tooth decay. Gum disease, gingivitis, and periodontitis. Chronic mouth breathing can contribute to the development of gum disease. The dry conditions in the mouth create a breeding ground for bacteria, leading to inflammation of the gums, gingivitis, and if left untreated, more severe gum disease, periodontitis, which can result in tooth loss. Bad breath, halitosis. Dry mouth is a common cause of bad breath. Saliva is responsible for flushing out food particles and bacteria that cause odors. When mouth breathing reduces saliva flow, these particles remain in the mouth, leading to persistent bad breath. Altered oral pH balance. Saliva helps maintain a neutral pH balance in the mouth, which is crucial for preventing tooth decay and gum disease. Mouth breathing disrupts this balance, making the mouth more acidic and conducive to bacterial growth. This imbalance can lead to enamel erosion and increased sensitivity in teeth. Impact on oral structures. Mouth breathing can affect the development and positioning of oral structures, particularly in children. It can lead to an elongated face, a narrow palate, and misalignment of the teeth, conditions that often require orthodontic treatment. In severe cases, these structural changes can contribute to sleep-disordered breathing, such as obstructive sleep apnea OSA. Speech and swallowing difficulties. Chronic mouth breathing can affect the way we speak and swallow. The improper positioning of the tongue and oral structures can lead to speech impediments and difficulties with swallowing, which can impact a child's development and self-esteem. Sleep disturbances and sleep apnea. Mouth breathing is often associated with sleep disturbances, including snoring and obstructive sleep apnea. When the airway is obstructed during sleep, it can lead to interrupted breathing, poor sleep quality, and a host of related health issues, including fatigue, cardiovascular problems, and impaired cognitive function. Increased risk of infections. Because mouth breathing bypasses the nasal passage's natural filtration system, it increases the risk of respiratory infections such as colds, flu, and sinusitis. The unfiltered air can introduce bacteria and viruses directly into the respiratory system, leading to more frequent and severe infections. Given the significant benefits of nasal breathing and the potential drawbacks of mouth breathing, it's important to adopt and encourage nasal breathing habits. Here are some strategies to promote nasal breathing. Practice conscious nasal breathing. Make a conscious effort to breathe through your nose during daily activities. If you catch yourself mouth breathing, gently close your mouth and shift to nasal breathing. Over time, this will become a habit. Nasal breathing exercises. Engage in exercises designed to improve nasal breathing. One simple technique is to inhale deeply through your nose, hold your breath for a few seconds, and then exhale slowly through your nose. Repeating this exercise can help reinforce the habit of nasal breathing. Manage nasal congestion. If nasal congestion is a barrier to nasal breathing, consider using saline nasal sprays, humidifiers, or other remedies to keep your nasal passages clear. If congestion is chronic, consult a healthcare professional for advice on managing it. Address underlying issues. If structural issues, such as a deviated septum, are preventing you from breathing through your nose, consult with a specialist. In some cases, surgical intervention may be necessary to correct the problem and promote healthy breathing. Mouth taping at night. For those who mouth breathe during sleep, mouth taping can be an effective way to encourage nasal breathing. Special medical tape can be applied across the lips to gently encourage nasal breathing. However, this should be done with caution and preferably under the guidance of a healthcare professional. To summarize, the way you breathe, whether through your nose or mouth, can have significant implications for your oral and overall health. Nasal breathing offers numerous benefits, including better oxygenation, protection of the respiratory system, and support for oral health. In contrast, habitual mouth breathing can lead to dry mouth, increased risk of tooth decay and gum disease, and even affect the development of facial structures. Understanding these differences and making a conscious effort to breathe through your nose can improve not only your oral health but also your overall well-being. In the next lesson, we'll explore techniques and practices for breathing re-education, where you'll learn how to make nasal breathing a natural part of your daily routine. Thank you for joining me, and I look forward to seeing you in the next lesson.